Well, the fact that medical corruption is rampant in India is no secret at all. But now, perhaps for the first time, hard evidence laid bare for all to see. Doctors not even pretending or trying to cover up the fact that they prescribe medicines only for kickbacks. It's rampant, it's blatant, and it's utterly shameless. A huge, huge wake-up call for all of us. The doctor-patient relationship, one of absolute trust, being completely betrayed. We have with us tonight all the stakeholders to react to this expose. Some of the most distinguished doctors in the country, representatives from the Medical Council of India, supposed to be the country's medical watchdog, which many argue has really been co-opted and chooses to look the other way. We have representatives of pharma companies as well. Joining us tonight, Dr. Shamiran Nondi, a familiar face for all of us here on NDTV. He's also chairman for the Committee for Ethical Practice, gastroenterologist and surgeon at Sir Ganga Ram Hospital. Dr. Devi Shetty, chairman of Narayana Health, one of India's best-known cardiac surgeons, joining us tonight as well. From Patna, we're being joined by Dr. Ajay Kumar, former president of the Indian Medical Association. He's a member of the Medical Council of India as well. Also from the Medical Council of India tonight, Dr. Jaiveer Singh, representing the pharmaceutical companies. We have Ranjana Smetasek, Director General, Organization of Pharmaceutical Producers of India, the organization, the umbrella organization for pharmaceutical companies in India. She's worked with Fortis Healthcare and Ranbaxy as well. Sonal Mehrotra, who brought you that undercover investigation, is also with us tonight for all the questions that her story raises. But Dr. Ajay Kumar, I'm going to begin with you. We've brought you hard evidence tonight, incontrovertible proof of 3 Delhi doctors either asking for or actually accepting bribes. Will you promise on live television tonight in front of a nationwide audience that the Medical Council of India will not turn a blind eye to this story?
Let me tell you certain facts now. When I was approached to appear on this news channel, I asked one question: if these doctors are guilty, can you complain to Medical Council of India that these doctors are guilty so that we can take the cognizance and punish them if they are found guilty after investigation? I was told, no, we will not formally complain. This is the problem. We all know that the doctors are getting more and more corrupt. We know that the things are going out of the hand. Whatever you have shown, I am not going to defend. As a matter of fact, I am happy that you are showing such things on the television. But I want more and more organization and people to come forward, complain formally to Medical Council of India or the State Medical Council about these doctors so that we can take action. And we are already in the process of doing that.
Why are you being bureaucratic about this, sir? Dr. Kumar, why are you being bureaucratic about this? The evidence is in front of you, sir. 3 doctors caught on camera either asking for expensive bribes or actually in one case accepting money. So if this is not proof enough for you to act, then what is?
You don't worry, because you have already named these doctors. You don't worry. The meeting of the ethics committee is day after tomorrow. We will take up the case suo moto against the doctors. But what you are showing is only the tip of the iceberg. There should be more and more complaints from those people who are, the citizens of this country or NGOs. You know, recently in Madhya Pradesh, an NGO has come forward, very bold people. We have taken the case of about 25 doctors who went to Edinburgh to enjoy on the drug companies thing. It's already under investigation. Very soon we will come to the conclusion. Same way there are many other cases which are coming as soon as they come. You see, when this sting operation took place, the government took about the laboratories. Immediately we sort of sprung into action within 3 days, and we have investigated and we have recommended to the government what to do about them. So it's not that we don't do it, but we must be, told, we must be shown, we must be given certain proof, then only we act. And I'm really worried about what is happening in the medical profession. You know, there are few people
All right,
who are doing it.
You're saying, sir, that this is the tip of the iceberg. We accept your point. These were doctors selected completely randomly from 3 different neighborhoods in Delhi, in Western Delhi, Central Delhi and South Delhi. They were picked without any past record as such of accepting bribes. And sure enough, in all 3 cases, there was only too much eagerness shown in a way to accept whatever was being offered to them. Yes, we are on this program naming and shaming these 3 doctors, but in no way are we saying that this is a problem that's confined to just 3 of them alone. But in this case, we're asking you, are you going to make these men examples? These are visuals we are seeing on our screens at this point. Dr. Jain Saxena from Patel Nagar, Dr. Lalwani, a doctor based in South Delhi, Dr. Ravinder Kumar in Central Delhi, all 3 of them caught on camera. For once, will you send out a message once and for all that patients' health and their lives cannot be trifled with?
I will request you that you send the CD of these doctors to us by tomorrow to the Medical Council of India, and be rest assured the day after tomorrow in the Ethics Committee, the matter will be taken as a matter of priority. And I want that more and more people come forward and complain about such black ships in our profession, so that we take action and let people know that we are very serious about such type of activities.
We will follow this up with you, sir. I promise you we will provide you with all our unedited hidden camera footage, but we will also continue to keep asking you what action you take against them. I want to bring in Dr. Jaiveer Singh, also of the Medical Council of India. Are you now going to uphold your own rules and regulations? There's a directive that doctors should prescribe generic drugs and not brand names. Medical Council regulations say any doctor accepting a gift worth over 1 lakh rupees can be struck off from the medical registry. At least one doctor in our story tonight demands an SLR camera, easily worth more than 1 lakh rupees. What kind of punitive action are you going to take against him? Will you in fact strike him off, as your own regulations state?
Yes, we are going to do it. As Dr. Ajay Kumar told right now, we are going to take the action against these doctors who are taking the bribe. But here I am a little bit different. It is not the fault of the only doctors, it is the fault of the company also, who are prescribing, giving the bribe and taking the bribe. Both are the wrong things. Though the Medical Council of India has made the regulation about it, and we are taking the action, and day after tomorrow there is an ethical committee meeting, and certainly we are going to take the action against these doctors.
Okay, fair point. And Ranjana Stemasek, you're joining us tonight in your capacity as Director General of the Pharmaceutical Producers of India. Should we be laying all the blame at pharma companies' doors? I mean, what are you doing to police yourselves? This clearly seems to be a rampant problem, is the fact that pharmaceutical companies are out there offering inducements, just vitiating the atmosphere even further.
Thank you for inviting me here, Ankita. And it's really painful for me to see this kind of footage. These are the sort of instances, I think, which really are a blot on the entire healthcare industry. I am here to represent the Organization of Pharmaceutical Producers of India, and all of our members are strictly bound and strictly adhere to the OPPI's Code of Pharmaceutical Manufacturing Marketing Practices. And this code is based on the model code of the IFPMA, which is the International Federation of Pharmaceutical Marketers Associations. So I have, to me, this is really difficult, and in fact I would really be happy to see that the Department of Pharmaceuticals Universal Code, if that were made statutory, because I think it's time it's really time that we were able to, demonstrate our commitment to ethical business in India, and I think we need to step up and make these codes mandatory. Thank you, Ankita.
Now, Ranjana, it's all very well to be discussing all of this, to be saying, what the ideal situation is. But the fact of the matter is, for instance, the British Medical Journal says that the health services sector in India is the second most corrupt service in India after the police. How do you respond to a statistic like that, to a fact like that?
So I think all of us will have to step forward and change this perception or change this data. To begin with, clearly, you know, we can only, I mean, I can only speak for those members that are, those companies that are my members, which is, you know, 35 odd pharmaceutical companies. But we have been working very hard to push the Department of Pharmaceuticals to push push for the universal code of pharma marketing practices to become a statutory code rather than a voluntary code. So I hope that maybe
now,
if
Ranjana,
your
I'm
program,
going to make this point that
if I can just finish, Ankita,
yes.
if I can just finish,
yes.
If your program serves to bring this to the attention of government and they make this a statutory code, I think it will be a good thing served.
Okay, statutory code, all very well, and we certainly are going to be discussing remedies as much as we are highlighting the problem on this show. But including all the big pharmaceutical companies, this seems to be a problem that's rampant. And I'm going to bring Sonal Mehrotra into this discussion now, the reporter who brought us that story tonight. Sonal, you know, you spoke to a lot of people who talked about this as a practice that's undertaken by pharma companies across the board, including some of the biggest names present in the country. So this is by no means restricted to new companies that are starting out, trying to create a name for their brand, who are going to doctors and offering them inducements.
One really needs to know at this point, very categorically, one of the doctors has told us on camera that all companies do profit sharing, big or small. What does this really mean? And is this just going to be lip service that we're hearing at this point? We also perhaps need to understand from the pharma companies, and they should be in fact forthcoming to tell us if the pressure is also coming from the doctors. Because one of the doctors also very categorically told us that, you know, it's not, if we do not offer him bribe, there are several other companies available in the market who can. So it is a fish market. It is going to be who is the most hard selling, which is the company, which is the pharma company giving the doctor the maximum amount of incentives, and that will determine which, which brand the doctor goes on to prescribe. On the whole, there are two basic things that are involved in this entire story. Number one is the cost of care. There is a simple, just for example, I was just checking up and it realized that, a simple neurotic painkiller medicine could cost between 54 to 5 rupees. So why this disparity? Pfizer, for instance, has a single tablet for about 55 rupees, and a same tablet with the same composition and the same medical component produced by Cipla is just sold for 6 rupees. So why is this disparity? And when the doctor is prescribing these medicines to the patient, is this information really getting to them? Are they being informed that both these are available and perhaps they should go for the cheaper one? Second, what are the health risks? And that really is the big question here. There are studies after studies in Australia, in US and in UK, wherein doctors have talked about the risks involved of overprescription. They are fearing that there would be a point where overprescription of especially antibiotics would lead to an entire generation of patients who would not, who would be resistant to all of these antibodies. So these are some very hardcore questions that need to be addressed at this point. But again, if you could take that question to the pharma representative here and ask them, are doctors really, before, in fact, let's also make it clear, not all doctors, we're trying to say in this investigation, have been corrupt. But however, the majority of them we visited all turned out to be, it was almost routine business for them to ask for these gifts.
Those are important points you're raising, Sonal. And Ranjana, as much as I'm going to get a quick response from you before I bring the doctors on our panel into this discussion. The cost of medicines would clearly go up if each pharmaceutical company is factoring in the fact that you're going to have to pay between 15 to 20% in kickbacks. You're offering those to doctors. Pharmaceutical companies are offering those. So also, there is the problem of over-prescribing, and as our story showed, perhaps the problem of unnecessary prescriptions, giving a tonic to someone who's suffering from high BP, something that has no correlation at all, from a doctor who says he's doing it only to meet his targets. Where does that leave the patient?
Anandita, I'm not going to presume to speak for the entire pharmaceutical industry. I can only really speak for my members. I have to tell you that we take this so importantly. We consider ethics and compliance to our code as so important that we it is part of our agenda in every monthly meeting. We discuss this, we make sure that any complaints are taken up on a priority, and therefore I know that the OPPI really can look with a clear conscience and say that we are doing everything that we can to make sure that we are abiding by an ethical code of conduct.
Okay. I'd like to bring in our specialist doctors on the panel tonight. Very well known, very well respected names. Dr. Devi Shetty, I'm going to come to you first. Our report talks about this hierarchy of payoffs, general physicians being at the bottom of the chain, specialists getting more, cardiac specialists and diabetologists being at this sort of premium, perhaps because they're going to prescribe medicines that people are going to take then for the rest of their lives. Are you shocked by how organized all of this seems to be? Or has this always really been an open secret?
I think corruption has become part of the healthcare system. Not only in India, it is very, very prevalent even in the developed countries, in spite of so many regulations. It is sad that in India it is gradually spreading across. It wasn't like this 20 years ago when we were young surgeons starting our career. It was never like this. Things are definitely turning bad. But I think time has come for us to look at the regulations, especially from the corruption point of view. There has to be two characters, one person who gives and another person who takes. It's pointless only looking at the doctors. We have to look at the entire industry and find out the giver. If somebody is enticing the doctor, is he liable for any punishment? Right now, I am not sure whether we have any regulation controlling that aspect of industry. There is a large industry. Healthcare industry is a very large industry. Doctor is not the only player. There are many other players.
Right.